So, hi everyone. This is Nicole Walker, physician assistant here with Norterra Family Medicine. I am bringing you your Wellness Wednesday for June. And so today I want to educate about a topic that a lot of people think is really hard to talk about, and it is. It's really talking about end-of-life care, and more specifically, I want to talk about hospice and what hospice is and what it can do for patients. So one, this is recently definitely a close topic to my heart. I know some patients know, but my father was recently on hospice services prior to his passing. So I feel it is very important to understand how an individual and their family can benefit and really be supported from hospice in a very, very difficult time. So my dad, he was on services with Hospice of the Valley. And today I have Scott with me. He is a clinical services director with Hospice of the Valley. He's going to be here to help us understand what hospice is and just ask some questions that I'm going to go through. So welcome, Scott, and thanks for being with us.
Thank you for having me.
Yeah. Okay. So just to start this off, all right, I'll ask Scott, can you define like hospice? Like if you were meeting with a potential patient and their family, how would you define and tell them what hospice is?
Yeah, that's something that I've had the opportunity to do many, many times. And I lead the group of nurses that go out to have that conversation with patients and families. And so the way that we like to think about this is that hospice is a philosophy of care. And it's something that you never want to have, but is so beneficial when you need it. And so we really think about hospice as a way to keep somebody home if they want and need to be home, and to make some changes in how they approach medicine. Typically, hospice is reserved for those that are in their final months or even year of life. And the goals are much more oriented around comfort. And that comes with some misconceptions sometimes because comfort can imply final days, which certainly isn't true. So patients on hospice can continue to see their doctors. They could continue to see you, for example,
Mhm.
and your provider group simultaneous to hospice care. But we really like to come in and support the family with training, education, provide supplemental visits to make sure that the individual is comfortable and has as much quality of life as possible during that time.
Okay.
So really what that looks like is it's a team of people that come to the patient. And it usually consists of a registered nurse who's the case manager. And he or she would come out really depending on what the needs are. Some people are stable enough with their illness that they don't need somebody coming out all the time, but nice to have them available should issues come up and to help out with, medical questions that they might have or treatments that they might need to receive in the home. But that nurse is working very closely with our medical providers, really focusing on simplification and comfort as the primary goals there. There's a nursing assistant who's typically part of that team as well. If the patient and family are open to that and they can help out with hygiene needs, certainly not a requirement, but something that we're really proud to offer. Same with the social worker availability. There's a lot of questions that come up for people as they're facing that time of their life that they may not have planned for. And there's a lot of misinformation about all of that too. So to have somebody who's connected with the community and knowledgeable about resources that are available can be tremendously helpful. And then of course we have chaplains and volunteers and a lot of people that are wanting to make sure that it's the best experience possible. But another misconception is hospice is a place where you go. That's sometimes the way that it's portrayed in the media, and some families have had that experience where we do have hospice inpatient units, and we're very fortunate at Hospice of the Valley to have those really scattered throughout the valley. But that's really what we think about as a hospital for a hospice patient, right? So if symptoms need to be managed a little bit better than they might be able to at home, or something's going on that would require around-the-clock care, somebody might go there temporarily with goals to get back home. But usually hospices, we come to you and provide training, education, and help with your medical needs in the home setting.
Okay. I will. I mean, I'll speak to our own experience was in my parents' home. And really I had a want to do this for our patients because I don't feel my parents understood what hospice was. And I had to really push and advocate for them to allow someone to come in and talk to them about what the needs were and how it could benefit. They did see it as, hey, this means it's the end for him, which you know, whether they wanted to or not, that was going to be there. And I just felt his management of his symptoms, his pain, his safety in the home was being compromised. And I wanted to do everything we can to help them and keep him comfortable. So it was hard to get them to accept maybe an interview and meet somebody and just understand what it was. And that was a big thing for me. And hospice definitely helped come in and just meet with them and explain and tell them about it. So I think that's excellent. I think everyone's care is a little bit different in the needs, but I think you kind of explained kind of what our needs were, and they were definitely met bringing Hospice of the Valley in. Now, there's qualifications, I think, like certain pieces or criteria, like how does somebody qualify for a hospice service?
Yeah. For the longest time, I think people associate hospice with cancer. And a lot of times that's true, of course.
Mhm.
But people can qualify for hospice really with any illness that's leading to a decline toward end of life. So we have a lot of patients that come on service with end-stage lung disease or heart disease, neurodegenerative diseases like dementia or Parkinson's disease. So really the question is more about, is somebody in their final months of life? And that's a difficult question to answer, even by the best of medical professionals. We always talk about lacking the crystal ball because sometimes people might look really, really sick, and with some extra help, they actually
Yeah.
come off of hospice services.
Yeah.
So we like to consider the question as a medical professional, if the disease were to run its typical course, would we be surprised if this individual reached end of life within a 6-month period of time? And if the answer to that is no, then hospice is a reasonable model of care. And also, the way that it works is that we have the ability to recertify patients for hospice care. And so just because Medicare is the primary payer source and regulatory body for hospice care might say it's for 6 months. If somebody continues to decline past that 6-month time frame, we might have somebody on for a year. It just totally
Yeah.
depends on them as an individual. But
Okay.
each disease criteria has certain, or each disease category has certain
Mhm.
criteria that we look for in addition to what's happening with the whole person.
Okay. So like if you hit the 6 months, it doesn't mean, hey, it runs out. No, you look at the criteria. Are you still applicable? Do you still meet that criteria? And then it can continue.
Correct.
Okay.
And really what we hope for, and this is work that we're doing out in the community with our hospital systems and providers, and I think conversations like this help considerably, is to make sure that people know about the services earlier, because it's a
Yeah.
much better experience for them and for their family if we can get involved, before it's those final days of life,
Yeah.
because that can feel that, it's just not as good as an experience as if you have
Yeah.
that trusting relationship with your whole team for months leading up to that point.
Yeah. Well, and I mean, a personal speak to that. My grandmother had been on hospice, but it was the last day or two of her life only. And I think although it was very beneficial, and she actually ended up at an inpatient hospice of the valley, but although it was very beneficial, I think that gave this portrayal of hospice differently than what really it could be. And that was a hesitation for my parents. So it's
Yeah.
very true. I think really utilizing the benefits is so helpful, so helpful.
Well,
Now,
I'm sorry. I was just going to
go
share.
ahead.
I've worked here for 15 years, and if there's one common theme we hear from families, after the fact, it's that they say, I wish we would have known about this sooner.
Yeah. Okay. And that's our goal. We want people to know about it. Yeah. Now, what about costs, like insurance costs for hospice? What if someone has difficulty affording the services?
Yeah, so a few things to take into consideration there. So I can only speak for Hospice of the Valley, when I say that we will care for somebody regardless of their ability to pay. Whether you have no insurance or, whatever the story might be, if you qualify for hospice services and need our help, we're going to provide that service. We take our mission as a not-for-profit organization very seriously, and we do, 12 to 14 million dollars in uncompensated care a year. Now, most people do have insurance, but there's some variation there. The majority of patients that come onto hospice have Medicare because
Mhm.
typically they're older.
Mhm.
Medicare has pretty much defined the hospice benefit as it relates to payment. And when we bill what's a per diem or a daily rate to Medicare, and it goes directly to Medicare Part A, and they cover the entire cost of hospice
Oh,
services.
okay.
And so we become responsible for really the management of anything related to that terminal illness and symptom management.
Okay.
But nobody would ever get a bill, that has Medicare from a hospice organization. Now,
Okay.
it's
Wow.
not covered, even if you have Medicare, is like room and board. If you need to
Okay.
be placed somewhere, you can no longer live at home alone. There's some misunderstanding about that sometimes, where people would
Mhm.
hope that we can, take their loved one and place them
Mhm.
in a long-term care setting, for example. There's really no Medicare coverage for that.
Okay.
But for the daily provision of hospice services, Medicare covers that 100%.
Okay.
Now, some people come on with what we would call a commercial payer. Maybe
Mhm.
they're not at the age where Medicare would apply, and they have, a traditional uh, insurance provider, right? The ones that
Mhm.
we typically
Yeah.
would see, Cigna and Blue Cross Blue Shield, whoever you might have through your employer.
Yeah.
In that case, almost every insurance company has a hospice benefit. And depending on the insurance that you have, you might have, like a typical deductible, out-of-pocket maximum, different things like that.
Okay.
Um, but people who would struggle with that out-of-pocket costs, again, we would never deny them our services if they weren't able to commit to that.
Okay. Okay. Well, that's you had mentioned, you can retain your primary care for certain things. And I know with my father, like he had his hospice services for specific diagnosis and whatnot, but for our patients, his primary care is Dr. Sorna here. And she was wonderful with my parents through this and met with them regularly for some of his other general things that were still being managed. And so yes, there was insurance and things used for that, but the hospice was definitely different. So
Mhm.
it was nice to have kind of both of those supporting him.
Yeah.
All right. Now, what if someone doesn't qualify, right? I don't want, if someone's like, well, I don't want to meet with them because I don't think I'll qualify. Well, what happens if you don't qualify?
Yeah, and that does happen. And to me, that's indicative of the fact that we're starting to have these conversations earlier, which is a really good thing. And
Okay.
a lot of times people have had, like you, a personal experience with hospice.
Hmm.
And they remember in a time of crisis, gosh, that was really helpful. I want that for whatever's going on right now. And so if we get out there, and let me just say really quickly that at Hospice of the Valley, the team that I lead, we err on the side of just sending a nurse. So
Hmm.
if we get a call from anybody, if it's a doctor or a community member, it might be your neighbor down the street saying, "Hey, I've known, Mrs. Smith for 15 years and she's not doing well. Could you send somebody out?" We're going to send somebody out. If we get out there and clinically somebody's just not meeting the criteria for hospice services, we have alternative services that we can
Okay.
offer in preparation for when hospice is the appropriate thing, right? Sometimes people just need help from a social worker to navigate the medical system and to better equip themselves with community resources. So that can be a really helpful thing. That program
Okay.
is called Outreach. We have a grant-funded dementia program called Supportive Care for Dementia, which is fantastic. And we can send educators out to help family members for a patient that might be, early in their trajectory with dementia, but families just need support, help, and education. And then, of course, we have our alternative supportive care programs. But I could go down that list.
Yeah.
It's an extensive one, but
Yeah.
usually we're able to find some supportive program if hospice isn't the right thing for them at that time.
Okay. So yeah, that's wonderful. Lot of things to offer. So I like that. Um, One other thing that I just want to ask about, because I believe there is some support, like what about the family? Like obviously there's relief because there's hospice coming in to evaluate and kind of give guidance and recommendations. But is there things that hospice does to support the family going through this process also?
Yeah. So of course, the patient who's experiencing the illness is the most important thing,
Yeah.
but the family is right up there. The language, according to Medicare, is that the term patient is inclusive of whoever their family is, in addition to the individual we're treating at end of life, because it is such a scary time. And, I think about often, there's been billions of humans that have passed before us. But when it happens to our loved one or to us, it's entirely foreign. We've not
Mhm.
experienced that before. So it's
Yeah.
scary. There's a lot to sort through. So much of what we do is for the family. We provide training to the family on how to, provide that care to them. I'm going to unplug this really quickly.
Oh, you're good.
And
Thanks.
then I know you have an editor. Okay.
Yep, you're fine. You're fine.
So we provide training to the family to make sure that they feel equipped to care for their loved one at home. And also we have medical equipment that we provide. So if that's a
Yeah.
hospital bed,
Hmm.
oxygen, a table, a wheelchair, a shower chair, we want
Yeah.
to make sure that with that training come the appropriate tools to be able to do that successfully. And then our social workers are really equipped to talk through the emotions that come up for family members as they're witnessing the significant change that their loved one is experiencing. I used to visit patients at any time of the night. I was what we call a triage
Hmm.
nurse for hospice in the
Okay.
Valley. And I would go from Queen Creek to Tonopah and Wickenburg to Rio Verde. But if there was something happening at 3 in the morning, I was the guy.
Yeah.
And I always felt so strongly that I was as much there for the family to, make sure that they knew that everything was okay and that we were going to take care of whatever the issue was as I was for the patient. Um, the last thing I want to mention about that is we offer bereavement services, which is, up to 13 months of support for families who have experienced a loss on hospice.
Mhm.
And so our bereavement counselors are fantastic. We have group counseling sessions available that are free to the community. But of course, people who have experienced our services are welcome to come to those. And then individual counseling sessions as well.
Yeah.
And that is incredibly helpful
Amazing.
for people who
Mhm.
might not anticipate what it's like to
Yeah.
experience the loss of a loved one.
Hmm. That's amazing. Yes. Well, I mean, is there any piece to this that you feel maybe I've missed? Have we kind of covered some of the different important areas with hospice, do you feel?
I think we've covered a lot of it. Let's talk about some misconceptions, and we've touched on
Okay.
this briefly,
Yeah.
but I just want to reiterate a
Yeah.
couple of things. Hospice does not have to be for final days of life. And I think that your experience that you referenced about your grandma was a really
Uh-huh.
great example. Sometimes it becomes a self-fulfilling prophecy, right? Where, we wait so long that
Yeah.
that's what happens.
Yep.
But I would really encourage people to call if you have questions. It doesn't hurt to call and find out more about it
Yeah.
and to have a nurse come out and evaluate.
Yeah.
And so I'm sure you'll have opportunity to share some of our information on the
Yes.
platforms that you'll be sharing this on.
Yes, definitely.
But we're available 24 hours a day, 7 days a week to answer questions that people have. But just really encourage people to have somebody go out and explain our programs to them.
Yeah.
We touched briefly on you can keep your relationships with your doctors. We recognize those as very, very important relationships. Sometimes
Yeah.
people are with the same provider for decades,
Yep.
and it would be silly of us to come in and say, well, you have to stop that and we're taking over.
Yeah.
So we work very collaboratively with the community providers. But again, one additional thing that I would want to mention, and this gives me a lot of pride as somebody who's worked for Hospice of the Valley for 15 years, is we're the only not-for-profit hospice in Maricopa County. And what that means is any extra resources and money that we have available goes back into patient programs. So those alternative programs that I mentioned, like our outreach programs, supportive care for dementia, those are donor funded or funded through
Yeah.
our not-for-profit dollars. And those not-for-profit dollars also give us the capability to send somebody at 3 o'clock in the morning, or to have inpatient units should somebody need that level of care. So I think making sure that you do your research on the organization you're selecting is really, really important.
Yeah.
Yeah.
Yeah, definitely. Yeah. Well, I'll say, I talked briefly a little bit about, my experiences. I think that, working with Hospice of the Valley specifically, um, it was very difficult to talk about where we were at with my dad. And, they opened that up. They opened up that conversation and made it easier. Sorry.
It's okay.
Um, that we could kind of accept it and know that we were going to help him go through it the best way that he could and keep him comfortable. And it helped us accept that and have that conversation and amongst ourselves also, that it was just hard to get to that point. So
Mhm.
it was amazing, that's for sure. And we utilized everything. The nurse was wonderful. My mom absolutely, and my dad both loved her. We utilized those middle of the night services and they were amazing. In those moments, you really weren't sure, we need some help, what's best for him, and there, you're there. Utilized it. So it was amazing. So again, I have a passion that I want people to know about this, because I don't want it to be so hard to get someone to accept it and meet and learn about it, because it is so helpful for everybody kind of going through that process. So I didn't mean to get emotional. I was not going to. So sorry about that, guys.
No, I
Um,
really appreciate you sharing
yeah,
that, and
yeah,
that, trust that your family had in us to be part of
yeah,
that time in your family's life
yeah,
is really meaningful to
yeah,
us.
yeah. So, all right. Well, I want to say thank you to Scott and Hospice of the Valley for your time meeting with me and us today. I know we as providers, if you have questions, concerns, you want to have a conversation, please let us know. If you're not with us, or you can't reach us, or you want to talk to Hospice of the Valley or someone directly, I know we will make sure we get some information and contact. Like you said, there's 24/7 resources for you. So we'll make sure that comes up on the screen so you can use those. But again, I just want to say thank you guys. Yeah. And thank everybody for joining me for our Wellness Wednesday. I hope everybody has a great rest of your day.
Thank you, Nicole. Thanks, everybody.
Thank you so much. I appreciate it. I think this will be really good for our patients,
Yeah.
like I said. And I didn't think I'd get emotional, but it
Well,
is.
that's a real
Mhm.
situation,
Yeah.
and even in healthcare, it's a foreign thing to us, when
Yeah.
it's your own loved one,
Yeah.
it's
Wait, it's
different.
different. It
It's
is
different.
100%. Yes.
So, well, I
Yep.
really appreciate what you're doing. We do get, and I know this will be edited out. It's
Yeah.
so hard when we get patients that are referred to us in their final days of life,
Hmm. Yeah.
because it's, and we'll do it. We do it every day.
Hmm.
Our
Yeah.
median length of stay is about 11 days.
Hmm.
Um, we'd
Wow.
love to see that to be like 180,
Yeah. I think
but
my dad was
when,
between 1 and 2 months, I think.
and it's
I
so
think.
much better
Hmm.
for us to be able to get in there, reiterate
Yeah.
goals of care conversations,
Hmm.
simplify medications, work with the
Yeah.
family. Those weeks and months give so much to those final
Yeah.
experiences. But again,
Yeah.
just, personally want to thank you for
Yeah.
trusting us with that.
Yeah. Definitely. Definitely. And thank you so much. Yeah.
All right.
Yeah.
Well, take care.
All right. You have a good rest of your day.